For the next item, we will have our Henrico County Public Schools Health Committee presentation and update, as is traditional at each of our board meetings, and Dr. Beth Teigen and Ms. Robin Gilbert will be coming forward to provide us our Health Committee update.
Good afternoon, Chairman Cooper, members of the board, and Dr. Cashwell. Ms. Robin Gilbert, the Supervisor of School Health Services, and I are here again today, as Dr. Cashwell said, to share an update from the HCPS Health Committee. Here's the agenda for today's presentation. We will share highlights from the recent Health Committee meetings. We'll provide a quick review of the pandemic dashboard to include the CDC's school metrics and the thresholds set for the two core indicators. We'll review the data from Monday, December 7th, 2020 for Henrico County, the surrounding localities, and the data for the Central Health District Planning Region, ending Wednesday, November 28th. We'll remind everyone of the future meeting dates of the HCPS Health Committee as well. Ms. Gilbert will now share a few slides with you with the pertinent information.
Good afternoon, Mr. Chairman, Dr. Cashwell, board. It's nice to see you all again. Hope y'all had a nice fall break there. As Dr. Teigen and I have indicated, our Health Committee continues to meet every 2 weeks, with the meeting 12/7 being an added meeting post our holiday break. We have also added a post-break meeting following the winter holiday. After each meeting, our superintendent is updated. Our health indicators and local data is reviewed at each meeting, and more information will be shared with you today. As a continued effort to incorporate all aspects of information available for our committee's consideration, the group received mental health data from the Henrico Area Mental Health and Developmental Services on access to youth and family services. The first 5 months of this fiscal year have reflected an increase in access. The committee also received input from the crisis intervention team in Henrico, reporting a decrease in their referrals. This increase in community mental health access and lower referral rates internally is concerning that our student mental health needs and resource referrals may not be occurring with the decrease in face-to-face interaction. This data will help our committee to make recommendations for further interventions to support our students while in virtual learning. It would not be a decision-making factor for our recommendation on virtual versus face-to-face instruction. Our leadership team has worked closely with our employees and families to ascertain input for our learning recommendations. As our survey data from our school families has been tallied, schools are working to provide safe, socially distanced instruction spaces. Our teachers will be provided a 6-foot social distanced area at the front of their classroom. And while most classes will have desks socially distanced 6 feet apart, classes at 2 of our schools with high student return to in-person instruction will be provided a 4 to 5 foot social distancing, with 6 feet still being the goal. Families in these few identified situations have been provided this information and have the option to reconsider their decision for in-person learning. HCPS continues to strive to sustain the 6-foot social distancing in every possible situation. Contact tracing continues for both our employees and our students, both virtual and face-to-face. Since October 22nd, 97 positive COVID cases have been or are currently being followed, and 283 exposures have been asked to self-quarantine. Since our break, we have seen an increase in cases and that subsequent reporting. As of today, HCPS has experienced 2 what we call clusters or outbreaks of cases. One of these has been at an ancillary building. The other was at a school and was isolated to a support area. We have also had about 6 reports to VOSH, which means we have had 3 cases at an individual building within a 14-day period. HCPS continues to collaborate extensively with the Henrico Health Department. Most recently, the CDC provided new guideline recommendations based on quarantining times, which can be implemented as alternatives to their current gold standard of a 14-day quarantine for our exposure cases. And again, this is defined as an individual who comes in close contact, which is 6 feet or closer for that 15 minutes or more over a 24-hour period. The 2 alternatives approved: a 7-day quarantine with a negative COVID test on or after day 5. The alternative is a 10-day quarantine with no testing being required. These were considered by our health committee. During the discussion, input was provided by both Dr. Avula and our epidemiologist, Ms. Jackson. With the current community transmission at such high levels, and with the input of both Dr. Avula and Ms. Jackson, the decision was made to continue to implement the gold standard by CDC for exposures and require the 14-day quarantining period for our HCPS employees or students prior to the return to our school buildings. The committee, along with their community partners, will monitor our community data. We will continue to keep these new options on our agenda for further discussion based on that community data. Uh-oh, I'm technologically broken. All right, Beth, save me.
It's like someone has control of it on Teams. It's got the red around it, like it's being Teams, like.
Please pardon our technical difficulties as we work to get the presentation going again. It seems
Sean-
to be frozen there. Just one
Sean
moment,
is
please.
presenting, so if he could forward. It says Sean Conley is presenting at the top of the screen. So Sean has to forward it or stop. Excuse me? It looks like it was taken over.
Can I click on give control?
Well, let's see if we can.
It wouldn't advance.
It still won't advance. Oh, no. It's still someone.
Oh, there it goes.
Great.
Thank you. Not one of my strong points, technology. Okay, so now that we got the slide moved forward here, I'd like to review with you the 2 core indicators for Henrico. As of this past Monday, Henrico County continues to be at the highest risk level for the number of new cases per 100,000 persons within the last 14 days. The number of new cases continuing to climb and hitting new highs. At the same time, Henrico County was at the moderate risk level for the percent positivity over the last 14 days. From Monday to Tuesday, this metric increased from 6.3% to 6.8%, and from Tuesday to yesterday, this metric increased to 7.2%. And as you can see here, we have the earlier 6.3 posted here. As a reminder, the self-assessment at the Health Committee meeting determined Henrico being at the lowest risk level for a 3rd core indicator. Before we look at the data for Chesterfield and Hanover counties and Richmond City, I will provide a quick visual showing the thresholds for the 2 core indicators and consider the current status for Henrico. The risk levels here for Henrico from Monday, December 7th are circled here in red. And as I said, our cases per 100,000 are exceeding that 200 case per 100,000, our percent positivity, and our mitigating interventions continue to work well in our schools. Here are the risk levels for Chesterfield for Monday, December 7th. The total number of new cases per 100,000 persons for the last 14 days is slightly less than Henrico, but the percent of positivity test during the last 14 days is significantly greater. As of yesterday, their percent positivity was up to 9.4. These are the risk levels for Hanover as of Monday, December the 7th. Both the total number of new cases per 100,000 persons for the last 14 days and the percent positivity during the last 14 days are significantly higher than Henrico. Yesterday in Hanover, the percent positivity hit 10%, putting them in the highest risk category for both core indicators. And these are our risk levels for Richmond City from Monday, December 7th. The total number of new cases per 100,000 over the last 14 days, sitting at 346, and our percent positivity during that last 14-day period at 3.9, which is less than Henrico. However, their percent positivity has climbed to 4.7 as of yesterday. The increase in new cases seen within the central region over the past few weeks has continued to keep the region at a level of high burden and substantial transmission. The trend is now increasing with an average composite trend score of 18.4. I will now have Dr. Teigen share our last few slides with you.
As we transition into spring break, I wish we were in spring, that's wishful thinking. But as we transition into winter break, please know that the Henrico County Public Schools Health Committee will continue to monitor the CDC school metrics. The superintendent continues to be briefed after each meeting and advised of any recommendations related to student or staff safety. And at this point, Ms. Gilbert and I would be happy to answer any questions you may have related to the work of the Health Committee or the health metrics.
Thank you so much, Dr. Teigen, for your all's presentation. Start to my right, Ms. Kinsella. Do you have any questions for Ms. Gilbert or for Dr. Teigen?
No, I don't have any questions at this time. I just appreciate this update. It's alarming how the numbers just continue to increase, especially after the holiday. Thank you.
Mrs. Ogburn?
No question. Thank you.
Thank you, Mrs. Kinsella. I'm sorry, Mrs. Shea. I apologize.
I know we're all wearing masks here, Cooper, but I don't have many comments. I just want to thank you for pointing out that 2 of our schools, since they affect constituents in my district, will have slightly lower distancing, but those families who would be affected by that, so everyone knows, they have been contacted individually and have had that opportunity to change intent for their
Yes, ma'am.
So anyone who's listening who's wondering if it's their school or not, if they haven't been contacted, it's not impacting their school, correct?
Correct.
Thank you. All right, that's all. Thank you.
Thank you, Ms. Shea. Mrs. Atkins?
No questions at this time.
Thank you so much. Again, we thank you for your dedication and your diligence and helping to keep us safe. So thank you, Ms. Gilbert. Thank you so much, Dr. Teigen.
You're welcome.
Dr. Castro?